This week, we're recognizing National Nurses Week, a time to say thank you to the men and women who help and service patients nationwide.
They have quite the job. We're here with two registered nurses from Bay State telling us more about their roles in the medical world. Two Melissas.
Ladies, bravo to you both.
Yes.
Thank you for all
Thank
you
you
do
so
day in and
much.
day out, and for taking time out to be with us. We know you're busy.
Thank you for having
What
us.
made you want to become a nurse in the first place?
I actually started in another major, and I was in physical therapy. And so while I was in physical therapy, we do co-op. And I was able to
I'm sorry,
see
what?
co-op, which is an experiential learning. So you actually go onto the units, and I was learning what it was like to
okay.
be a physical therapist.
Sure.
And while I was there, I started realizing the impact that nursing had. I started seeing what nurses could do and how much connection they had with the patients, and ultimately decided that that's what I wanted and went back for that.
What about you?
And Melissa,
Well, when I was 17, filling out those college applications,
you knew then?
well, I knew that I wanted to be a nurse. The whole why, I just thought I wanted to help people, and I'm glad I did something right when I was a teenager.
Not a lot of us can say that.
Yeah, right?
You're part of a
Think
very
that,
elite
but-
group.
Yeah. But it just landed so much opportunity. You can do whatever you want in nursing. So I made one right decision
What
as a
floors
teenager.
are you on?
So I actually work throughout the hospital.
Oh, okay.
And I have a couple different hats that I play. I do house supervisor and patient placement, and then I'm an acute care and intercare flex nurse. So I go to all the units, all the adult units, and I've done that for 17
A few
years.
years.
Yeah.
So I actually worked in labor and delivery and maternity for a while, and then after about 10 years, I went back to school and got an advanced degree, and now I work in professional practice, nursing research, and quality.
That'll keep you
Well,
busy.
if you have any tips
Yeah.
for me, you
love
let me know.
Right. Future patient right
Yeah.
there.
There you go.
So we want to talk about some things that we might want to ask our nurses if we're, in a hospital setting or in a doctor's office. And we were talking before the break, there's really no question that's off limits. I mean, within reason,
Right.
of
Yeah.
course.
Yeah, I would say that why a lot of us went into healthcare is really to make patients feel comfortable while they go through this, whatever they're going through. If it's an uncomfortable question, we might defer it or not answer it, but we would encourage you to ask any question that you need answered to feel better. The other thing is that, honestly, we're trying to make a connection. And so I've never minded when someone said, "Are you a mom?" Or, "How long have you been a nurse?" Or, "What do you like about nursing?" So those, even some personal questions are okay. And I know we joked, but, asking us if we washed our hands seems a little bit blunt. But if that's going to make you feel better, for us to reassure you that, yes, we do put your, infection prevention as a priority. And so, yes, we did wash our hands. That's okay.
We are your advocate, but also know that there's no questions that's off the table. Definitely know that if we don't know the answer, we're going to find the answer for you.
And I loved one of the tips was sometimes you might not understand what the doctor is saying. They're
That
throwing
was
a
what I
lot
was
of
just
information out
thinking.
for you. It's doctor speak. It's okay to then ask the nurse to say, could you interpret what I just heard?
Yes.
Yeah.
You may understand 10% of it, and we can get down to your level and understand that he's talking up here, but we understand that you are just getting 10% of that. You're nervous. There's things that you just never heard before. So
Right.
we're there, to guide you and to help you and advocate
Remember
for you.
that
And we
the
thank you
nurse is
for
on your
that.
side, right?
Yes.
You're the
Oh,
advocate for the
absolutely.
patient.
And sometimes it's us. I mean, it's okay if we are teaching you and it's not clear. It's okay to say, I don't understand. Can you help me understand? Or if someone else has come in the room, maybe another nurse that you had the night before mentioned something that you didn't clarify. We're okay with that because, again, we speak multiple languages, and
Sure.
healthcare really is a language, and sometimes we have to translate for you.
Well,
And
we
you're
can tell
dealing
you're,
with people in the worst situations, so
you're both very passionate about your
yeah.
jobs.
Thank you.
Thank you.